Hello, everybody. Mark Rogers here on Talking Turning 65. And this is crazy. We're almost down to the end of another Medicare season. And so there's always interesting things that we need to talk about. But I wanted to bring on Leith. Thanks for joining me. One more week we're doing this.
One more week, December 7th.
December 7th. The Thanksgiving's right ahead of us, and we're gonna enjoy the family. Yeah.
Who's going to be doing anything on Thanksgiving but eating?
Eating. Yeah. No Medicare on eating, right? That's fun. And we want to take this opportunity to go through the House of Healthcare one more time, because I think it's important. Don't you agree, Leith, that when people are looking at Medicare, they understand how it all sets up, right? So let's go through it. It's like building a house, folks. And so you got your foundation down below and you have your Medicare card, Part A. That's your inpatient stuff. If you look on your Medicare card, that's your Part A. That's everything to do with your hospital, the expenses that go on in the hospital. That also has to do with your skilled care. When they send you out of the hospital, that's what, 3 days in your hospital and you're ready to go out to skilled care. That's your inpatient piece. There is a deductible to that. It is going up a little bit this next year, but this is original Medicare. And let's go through these things one by one. Secondly, Part B. Part B is your outpatient care. This is where a lot of your expenses are going to be in an outpatient setting. This is your testings, your therapies, your treatments, all going on. Doctor's visits, right?
Yeah.
Yeah. Cancer treatments, Leith, right? That's where it is. And Medicare is going to pay 20% of that. And so recognize the fact that you're on the hook. If you're on original Medicare, we're talking to folks if they are on original Medicare, know the fact that you're on the hook for 20% of this in the outpatient setting. Get a hold of this. Number 3, Part Ds. This is your Part Ds, and this is your drug cards. This is the time of year when you can look for drug cards over on Medicare.gov. Recognize there, too, these do change. I have clients that call me. We just do a quick 10 or 15-minute review, making sure we're good with that as well. But this is really the opportunity this time of year. If you are on a Medicare Advantage plan, if you're on a Medicare Advantage plan, you go, you know what? I'm just tired of running that road.
Every year it changes.
Every year it changes if you're on Medicare Advantage. And now maybe the time, if you desire to, is to look at a Medicare supplement. We've talked about in prior programs that you can go and apply for a Medigap plan, a Medicare supplement plan. We help you through these things, just some medical questions to answer. And then you get back to original Medicare. Medicare A and B is still in place, but you got that Medigap plan that allows you to go to any doctor, any hospital, no network. And it's a big deal not to have to mess with it. And you certainly like your Medicare supplement, don't you, Leith?
You always have to bring that up, that I'm on a Medicare.
I had to plead with you.
Is it my gray hair?
No. What I like about it is the fact is that you saw the light, right? There's a time you saw the light.
In my defense, I was on a great group health plan.
Yeah.
But I was tired of the network issue.
Got it.
1 year the doctors would be in network. The next year the doctors would say, "Oh, we can't see you anymore because we're not in network. We're not contracted with your carrier." So then I'd have to find a new doctor. In this area that I live in, I'd have to drive 30 miles to get to a new doctor. The Medigap supplement plan gives me the freedom to go to any doctor that takes Medicare.
That's right.
It's a good change. It's a good change. And it may not be for everyone. Maybe Med Advantage works fine for people, but I like the freedom. I don't want somebody to tell me who I can and can't see. And that's the bottom line. I want to go to the doctor I want to see.
And the other thing is, too, we're picking up right now lots of news across the country with regards to Medicare Advantage plans. What's happening is the networks are unstable a little bit. And so we've talked about in prior programs, the Mayo Clinic not taking major Medicare Advantage companies as well. And so it's recognizing the fact that the network is going to continue to be an issue moving forward in these plans. That's why we are really big about having a Medigap plan if it works for you. You may pay a little bit more each month, but you'll have the freedom to go where you want to go, and you'll also be able to not have to struggle with it year after year.
Well, and the thing is too, Mark, I think that you may pay a little bit more every month, because the premium is more than a Med Advantage plan.
Right.
But at the end of the day or at the end of the year, you may be paying more on a Med Advantage plan with any services that you have to pay for or deductibles, or sometimes it evens out. Do you want to pay it every month, or do you want to pay it when you're really sick and you need all the coverage?
And as you said, we've said before, the Medicare Advantage plans actually have maximum out of pocket of $5,000, $6,000, $7,000, $8,000. And that's not so with the Medigap plans. You don't have those sneaky out of pocket stuff like that. So,
and those are annual. Those out of pocket maximums are annual. So you'll be paying, maybe you came down with some illness or had a bad accident and you're going into the doctor every week or twice a week. You're going to be paying a percentage, co-pays, co-insurance.
Yep.
Whatever is not covered on your Med Advantage plan.
Treatments, dialysis, all those type of things.
All those things. Chemotherapy.
Yeah.
Outpatient chemotherapy.
Yeah.
I just encourage people to really look at your budget. Look at what your needs are. Do you want freedom to see who you want to see? Do you want to be tied to a network? Make a list. Those are the things you need to think about before you jump into either plan.
But at the same time, this time of year is where if you're on a Medicare Advantage plan, like I said, not to repeat myself, but you do have the ability to look at Medigap plans. You may not be a guarantee issue to come onto one, but we can help you together. We can help you find one that you medically qualify. It's fairly easy to Medicare qualify for those. The medical questions are fairly easy for those as well. And so that's how the whole house of healthcare is built. Again, it's understanding, if you understand, I'm a big advocate of having to make sure how Part A works, your Medicare Part A works, how your Medicare Part B works. It's absolutely critical to know those things because you can effectively build yourself a Medigap plan that allows you to go anywhere you want to go. Let's move one more thing here before we jump off of here, Leith. I wanted to talk about something here that is, if I can see if I can get over here. Come on now. So let's talk, Leith, real quickly about IRMAA. IRMAA is coming up on the docket. IRMAA is for folks, if you've had high income while you're working, or if you're in retirement and your income is higher than these thresholds, the government is starting to tax your Part B premium and your Part D premium. And just to be clear, it's an additional charge added to Medicare Part B and Part D premiums for individuals with higher income levels based on their tax return from 2 years prior. Listen, folks, I've been in the business for 20 years. Leith, you've been in the business for 20 years as well. This is something that came up. The government has instituted here in the last 6 or 7 years, this additional tax associated with higher income people, that you're going to pay more in your Part B premiums and more in your Part D premiums. Now, I will say this as well. If you are working right now and perhaps you are in a situation where you're looking to retire in 3, 4, 5 years and you're above the thresholds in the income, there are things you need to do now to prepare before you get to the Medicare stage of plan of age 65 that reduces your IRMAA. Because what people really hate is they really hate saying, "Oh, how much do you get charged for your Medicare Part B?" And I'm $185. I'm $350. What gives? It's that tax, right?
And plus, if you take money out of maybe you're mid-year and you take money out of an investment account or draw money down, and then they will come back and charge you. They will come back they can go back, what is it, 2 years?
2 years. 2 years, yep.
Yeah, they will look at your tax returns and they will come back and they will want that money back. So just because you didn't pay for it this year doesn't mean they're not going to come back and ask for it. They will get their money.
Absolutely.
They will get their money.
It's a huge
And I've had a couple of people say, "Hey, I just got this letter and I have to pay from last year because they took money out of a 401 or a Roth or whatever. It increased their income, so now they have to pay."
Yeah, no, that's exactly right. And one of the things that
they're not happy.
No. And one of the things that retirees will do is they'll go out and they'll buy an RV, 65, 66, 67, and they'll pull it out of their 401k and they'll buy an RV for cash. And that income just spikes up at that point. it just spikes up. It affects the IRMAA. So we have reports to show that your IRMAA tax, now you're going to be paying more than everybody else. And how many years you may be paying IRMAA, be very careful that you're not stick with the IRMAA tax. It's coming up, it's coming up, coming up. Make sure you understand to avoid or minimize the tax. And it's a big deal with a husband and wife, right? If they're making above the income thresholds, it's elevated. And Leith, check this out. I just heard this week that the IRMAA tax jump went up 9% for the next year here coming up.
Yeah, I heard that too.
That's a big deal.
It's a big deal.
Big deal.
It's a big deal.
And so people in retirement have got to know the fact that the little things like this that we focus in on, IRMAA, for instance, amongst many other things, is good. So anyway, it's all about planning. Let's move on. Let's move on to the news, shall we? So let's go to here, and let's go to here, and of course, I'm going to edit this on the way out the door, so we're all good. And let's see here. I'm going to go ahead and, how do I get this to work here? Custom. Okay. Let's do this like that. So why won't this, I love not being live. Let's do this.
Isn't it great?
Yeah. Let's see here. Let's do this. All right. And why is that green? Let's not go a different color here. Where is my blue? Let's go blue here. Okay. All right. Okay. All right, Lee, we're talking about Kiplinger. Kiplinger just came out with some news that we want to hit with. Major insurers scale back Medicare Advantage and Part D plans for 2026. Beneficiaries enrolled in Medicare Advantage and Part D plans might lose their coverage as United Healthcare, Humana, and Aetna, or CVS Health, scale back offerings for 2026. I just can't say how big a deal this is. If you're on a Medicare Advantage plan, CVS Health, Humana, United Health Group have announced that they'll pull back in Medicare Advantage plans next year. These changes are a response to financial pressures, including changes to government fundings and rising healthcare costs. This has led insurance carriers to scale back their offerings in less profitable regions. And so this is the thing. Insurers are feeling the cost pressures. And I don't know if you know this, but we've talked about this, Leith, is the government gives money to the insurance companies to fund these things, right?
The Med Advantage plans.
Very good. The longer-term cut is masked by the projected 2026 average reimbursement rate of 5.06, which is higher than the initial 2.23 proposed by Biden administration back in 2025.
24.
2020 back. Oh, yeah. When commenting on the patient impact of eliminated plans, Hunter says these exits will likely steer patients towards health maintenance organizations or plans which require more frequent referrals and limit patients to network of providers. This is why we're big on Medicare supplements. We shouldn't be seeing this type of thing that we have here. So
especially in the rural areas. That's really big.
Thank you. Our heart goes out. Our heart really goes out to if you're retiree in the rural areas, make sure you understand. Now, you may not have Medicare Advantage options, but maybe you're in an area like I am where there's a few available, but recognize this network thing could be an impactful thing that you might have to fight against. You might be surprised. So United Healthcare, the largest Medicare Advantage provider, is making strategic adjustments and will stop offering Medicare Advantage plans in 109 U.S. counties in 2026, impacting 180,000 people. So right now is the time, folks, you need to be checking in on this because these plans are sending out announcements and things like that. And so it very well could be that if your plan is leaving, you may be available to get on a Medicare supplement plan. I've done this in the past. And you might be able to, there might be a guarantee issue thing. So you want to make sure and work with an agent to say, how do I move now that my Medicare Advantage plan is leaving the county? Is there a way to be able to get yourself a Medicare supplement plan? moving forward.
Yeah, I've got clients who've called me and they've gotten the letters that their carrier is, or the hospital or the doctor's office is not going to be taking their insurance anymore because they're pulling out of the market.
No,
It's really, some of these people were in treatment. They were in heart treatment and cancer treatment.
wow.
It is a nightmare for people. Yeah.
Wow. Yeah, and the last thing you want to worry about is losing coverage or changing coverage. So recognize that when you work with an agent, you might be able to, the agent will know, hey, there's an opportunity to go onto a guarantee issue onto a Medicare supplement plan, allows you to do that. So there have been people that when you work with that personal agent, you can get that better coverage, if you will. Now, it's not going to have the gym membership, Leith.
Yeah. I always wonder how many people use the gym membership.
Oh, they want it. They want it.
I don't know if they use it or not, but
The Medicare Advantage plan.
maybe for the first month they use it and then it dwindles off like everything else.
I can't tell you the years that people are making healthcare changes. People are making healthcare changes based upon a gym membership. I want my Medicare Advantage plan to have how often do you use the gym? I don't really use the gym. And it was always something. Or dental coverage. They want their dental coverage. What's your dental plan on that Medicare Advantage plan really do? Get yourself a supplement plan that's hardcore and works really well. Anyway. All right, Leith, we're going to sign off. Anything else for the people as we roll into the Thanksgiving holiday here is
just, if you haven't done it yet, get your plan set up. I'll get busy. Don't wait till the last minute.
We've done that too. So get on Leith's calendar. Calendars is down below. Get on Leith's calendars. Yeah, look, that's great. All right, everybody. We'll see you maybe next week. And if we're having turkey together, we'll see you. And get on the calendar down below. We'll see you next time.